So my name's Chowdhury. I'm a haematologist. I work for NHSBT in Imperial. I chair the Emergency Planning Working Group. So Kate's our Business Continuity Manager for OTDT at Barnsley, Birmingham and Newcastle, and she's going to talk about incident management as practiced by NHSBT. So away you go, Kate.
Thank you. And yeah, I think obviously I apologise on behalf of everyone for the technical issues we have. They're sent to try us, but remaining calm in these situations is obviously what we're good at in incident management. So nice to be invited to talk at this forum today. I hope everyone's well. And yeah, I'm here to talk about how NHSBT does incident management. So as introduced, I work on the business continuity team, and I work as one of 6 managers, and we manage things on a regional and also a directorate level. Incident management for us is obviously a massive commitment, and it's something we take very seriously. We're certified to the ISO 22301 Business Continuity Management System standard. And that provides a really big level of assurance for any of our customers and patients, knowing that we're going to strive to make sure that we deliver their products and services as quickly as we can, even in the face of disruption. And that's where incident management really comes into its own. So in that vein, we just wanted to ask a question really to the audience, just to start off that interactive element of today's forum, and just ask yourselves, what's your understanding of incident management? What does that mean to you? So if you go to the VVOX session, if you can scan that QR code there, I'll just give you a moment. Hopefully you've been able to access that. And yeah, I'd just be interested, and I'm sure the wider forum would be interested in knowing what does incident management mean to you? If you think back to experiences that you've had, whether you've been involved in it directly, indirectly, I think this is a really good potential place to share that practice and understanding. Yeah, whilst you're sort of populating that, I'll just give you a little bit of background around what incident management is for us, and how the ISO standard makes us stay resilient and have that effective contingency in place. So we get audited every year by an external auditor, the British Standards Institute, and they come in and they conduct a rigorous audit programme with our organisation, and they look at all of the different sites where we manufacture blood and products and make sure that they are true to that standard. This does involve quite a bit of work throughout the year to make sure that we are complying with that, and hopefully, touch wood, every year we have been able to regain that certification. Brilliant. So the word clouds now come up. So if everyone could just take a moment to consider what we've got in this word cloud. Planning, contingency planning, absolutely. People interaction. You can't underestimate how important clear communication is in incident management. And I'm sure events such as the Manchester bombing, people remember clear lines of communication, or lack of clear lines of communication, unfortunately led to a response that could have been more effective and clearer, and that has come out of the inquiry. So that's a massive one for anyone working in incident management. Taking control of the event, absolutely. Unplanned incidents, they're our worst nightmare, because clearly we can't account for what we're going to be faced with. Yeah, so a lot of very relevant stuff there. So I think obviously people have had experience and understand the good foundations for incident management. So thanks for taking the time on completing that. I think that was really interesting and insightful to see what people have considered. Okay, so going back to our certification, what underpins that certification is key documentation. And I think with every organisation that has the MHRA regulating and scrutinising how we operate, documentation will always be the foundation for that, and traceability and understanding that procedures that should be followed are being followed. and that they're being maintained and kept up to date, which is why those regular review of that key documentation is important. Now, for us, we have a policy which our team own, the business continuity policy. Policy should never be pages and pages. It's quite a simple, straightforward paragraph which details our commitment to making sure that the organisation is compliant with that ISO standard I referenced earlier. MPD 539 is our critical incident plan. And that's really where we've got the meat on the bones in terms of what our incident management framework looks like. That involves our emergency teams at a local and a national level, and that also involves response mechanisms, in particular how we can trigger the plan, what triggers the plan, and how that ownership and accountability of who leads the incident and how all of that works. As part of that, we obviously have a commitment to exercising and training and making sure anyone with a dedicated role and responsibility is trained in their role and responsibility to make sure they are capable, competent and confident in carrying out that role in incident management. And we have a critical incident handbook which details key contact information. So if something happens out of hours, we have that covered, because you can guarantee the things that we really need a stringent and a full-bodied response on will be the things where we don't have our operational people on the ground in a normal working day. It will be something where we're challenged because we haven't necessarily got the resources or people to hand. So we have a really comprehensive list of on-call rotas, and those people on on-call rotas are subject matter experts, consultants, clinical experts such as yourself, to make sure that you can be there to support the incident management framework should we need to stand it up. We also have our sort of reprovisioning sites within there. So if one site goes down, we can refer to another site, and how that transition of work is reprovisioned over. And at the back of all of this, business continuity plans and business impact analysis sort of support that process by detailing how we actually carry out that contingency and what actions are in place, and that's at a departmental level. So these are really key documents for us, and as I've said before, training to the documents, making sure they're maintained, making sure they're current and up to date is really important, and this will be the same in every organisation that looks at incident management and business continuity. Traceability, accountability is, you know, really important, especially when it comes to being audited and having that internal assurance that we know we can carry on regardless of any disruption. Okay, and with our incident management framework, we have several levels, and this helps us to know which route that we need to escalate. So we have minor, significant and major. So anything that may result in needing, you know, more, sorry, I'm trying to think of the words. So anything that is effectively mass casualty, where we're looking on a surge for blood products, things like that, I would suggest that would always be a major. So something like where we had the London bombings, something like where we had the Manchester bombings, something where we do need to get all those subject matter experts around the table and make sure that we understand what the requirements are and what the impact is. So for that sort of incident, we're looking at an incident director being appointed, and, you know, making sure that we understand the longevity of the incident. It's not necessarily going to be resolved within weeks. On a slightly different note, you know, COVID came into being, and unfortunately that was an incident that went on for over a year, but it made us realise that incidents don't just have a very straightforward and predictable start and finish point. So that incident director needs to be the right person with the right expertise to be able to lead that incident and really bring the right people around the team and go with it to make sure that we can carry on delivering those key products and services. Those directors are trained, again, going back to roles and responsibilities. They will be trained to be confident and know what their role is in incident management. We're very, very keen on making sure that anyone who has a role and responsibility clearly understands what's required. Okay, and in terms of roles and responsibilities, do you know what your role and responsibility is in Vivox? Again, if you can go to the QR code and respond to that question within there, that would be fantastic, and we can get some ideas on roles and responsibilities and understanding of that around the table. So in terms of our roles and responsibilities, whilst that's just loading, all staff are encouraged within NHSBT to report anything that could have a major impact on delivery of products and services. Anything that might not have happened yet, but we can foresee it, again, that needs to be reported in. And we have critical incident managers within NHSBT who will then sort of triage that information. They'll get as much as they can from the person reporting that, and they will then make an assessment based on what they're being told as to which level it needs to be. So those severity levels come into play at that point. And then what happens is the appropriate emergency teams convenes. We get our subject matter experts around the table, and we understand what is required from them to be able to make sure that we can carry on delivering those products and services. Once this assessment's taken place, you know, it is collaborative. When we refer back to that word map before about teamwork, it is a collaborative effort, and all the affected departments and stakeholders need to be accountable for their part to play in incident management. This is where our on-call critical incident managers come into play, and this is where they can really support the organisation in making sure that they can lead based on the information they're getting, and never being afraid to ask questions of people who are giving them the information, because the more information they can get, the better assessment it will be in terms of what resources, which subject matter experts are required. As another on-call role that's really important for us is the patient consultant. So in the event of a mass casualty incident, as I've referred to already, or an external major incident, the on-call patient consultant is responsible for working with the National Medical Officer, providing clinical advice to internal and external stakeholders. This is where our hospital services departments really come into being, because as you should know, we don't deliver directly to scene. This is where our hospitals are talking to our hospital service departments and making sure they understand the requirements based on the incident. It might be that hospitals would notify hospital services if a major incident has been declared, but it could also come from the on-call consultant first. It depends where the source of the information has been reported through. Okay, so role in incident management, reflecting on what we've got here. So yeah, communication, again, very important. Coordination, yeah. Bronze commands, yeah. The provision, strategic coordination, not sure. Okay, so again, some really relevant and yeah, insightful points that we've got on this slide. And what I would say for those people who aren't sure what their role is, it might just be that you know, you need to just double check back at your trust or equivalent, and yeah, don't be afraid to ask what that is. Everyone has a responsibility to sort of escalate anything that they think may become an incident and may be a potential to impact on business continuity. However, if you do have a more specific role, then yeah, I'd speak to your trust, your colleagues, and just make sure that you are clear on what that role is. Because as I say, it's a team effort, and everyone, I'm sure around this table, has some part to play in incident management. Okay, so I've referred to mass casualty and external major incident planning. And in that vein, what I'd say is a learning that we had from the Manchester arena was around people being really willing to come forward and want to donate blood, because they could see that obviously it was something that would involve, you know, a surge for demand. But we're really keen as an organisation to say, you know, book through the normal system, so go on the website, book an appointment, and not to sort of come in directly, because we did find at donor centres we had quite a lot of footfall, which created a different sort of pressure on our staff in those donor centres. But you know, it's really heartwarming to know that people out there really want to help in times of need, and especially something as harrowing as these types of incidents. So we do encourage people to donate, but we do ask them to go via the normal routes rather than dropping in, if you like, into these donor centres. Planning specifically for mass casualty and external major incident planning, the detail around that is referenced in our major incident document, which I referred to earlier, our critical incident plan. And there is a dedicated action card for our on-call patient consultants, which have key prompts on there to just give a little bit of guidance around what sort of considerations may be required in this type of incident. There is also specific guidance for hospital services staff, as I said before, so that they're clear that there may be specific requirements to consider. Again, going back to roles and responsibilities being trained out comprehensively, that's something that we're really keen on. It's also worth noting, and we have referred to this already, that we don't deliver directly to scene. And this goes back to traceability and our requirements as per the MHRA. We deliver to hospitals or major trauma centres, and that way they can distribute it accordingly, and it's much more traceable. So we know if there are ever any issues with you know, the donation process, we've got that traceability around that. And obviously the most recent thing being the infected blood inquiry, that sort of sings to the same notes that have come out of that inquiry as well. We do have mutual aid arrangements in place with our counterparts in Scotland and Wales, Northern Ireland. So if we do have a need to bring blood in, you know, sort of quick time, then we do have that arrangement where it can be discussed, and we do meet regularly with these forums to understand where our blood stock levels are and yeah, any requirements for support. So we have got a good support network around us in these types of incidents. And this slide just really demonstrates how there are so many allied organisations in terms of the NHS and trusts, and this is how we fit into it. So obviously, being an arm's length body, we aren't sort of at the heart of it, if you like, but we support all of these organisations and vice versa. We have regular meetings with NHS England, Department of Health and Social Care, to make sure that we understand incidents affecting them and incidents affecting us, and how we can better support each other. So this diagram just explains really how we feed into these organisations and yeah, the complexity of what we have in terms of the health service, but that we are obviously a key part of that, albeit an arm's length body. Okay, so to close the session, just to summarise really, I think the key themes that have come out of this is around roles and responsibilities. It's around the fact that, you know, good incident management, good business continuity, contingency really does come from having that shared understanding of roles and responsibilities and what we need to do as a team to support that. So happy to take any questions, either, you know, at the end of the session or in feedback following the session. But thanks for your time, and I hope you found it informative.
Thank you, Kate. I think you bring with you such extraordinary experience, you know, having started working with the Manchester Police, and it was a real privilege for me to work with you, and I hope that that's given confidence to the transfusion community that what they need will be there when they want it. But you emphasized a couple of things, didn't you, which was around actually supporting the event well beyond the acute phase, and that continuity of care and the patient journey and that surgical tale. I think something will come out from some of our other extraordinary speakers. Now, you offered to take Q&A. I think if people could pop that into the Q&A icon, and we'll probably pick those up as we go. And I suspect there will be stuff in chat. But I think you have given us the confidence to really focus on major incidents.